0033. Or send a WhatsApp to 05522 The hashtag all the time is hashtag Wanamoni and hashtag Ghana Abre. Right, so Corruption Watch has 6 segments which we bring to you as and when of actors involved in the case or matter under discussion, and we will also have From the Streets, which is where we share stories. Okay, what was your experience with the sharing of food packages during the lockdown, and what is your experience with the business support? Okay, so my guests this morning, I'm very excited that they're able to join us. Dr. Gabriel Benaku, who is a medical sociologist and former national chairman of the Ghana Coalition of NGOs. Hear more from our guests. Let's give you the context for today's conversation. Winston, take it away.
Well, Kojo, so soon after, the coronavirus pandemic struck Ghana, government introduced the coronavirus. The key intervention areas under CAP included provision of COVID-19 test kits, extra allowance to frontline health workers, income tax exemption for and provision of financial support to small and medium-scale enterprises. Now, in its 2021 budget presented to Parliament last Friday, government said under CAP, it provided cooked meals to 2 million to 470,000 families. Government also says it fully covered water consumption for all Ghanaians from April to December 20 of other customers by 50%. Furthermore, government says it rolled out a 750 million CAP bus program in May 2020 to directly support micro, small, and changed the vulnerable from having full benefits of the program. Therefore, in 2020, the Governance for Inclusive Development Program of GIZ Ghana and Send Ghana intended to promote transparency and accountability in the COVID-19 mitigation measures. And the research was conducted in 3 themes and rated them as satisfied, not satisfied, and somehow satisfied. And the 6 broad themes or indicators are efficiency, effectiveness, impact, satisfied with the level of stakeholder involvement, and transparency. Whereas some of the respondents were satisfied with efficiency and impact of the coronavirus, and 30 were not satisfied and satisfied respectively.
Thank you. Thank you very much, Winston, Country Director for Send Ghana. He's here with Dr. Gabriel Benaku, who is a medical sociologist and a former chairman. And this is a very fascinating study. I've had a look through the report. So there's a lot in there. Why don't you first...
Thank you very much, Kojo, for having us. All of us are Elevation Transparency and Accountability Project that Send Ghana launched in partnership with the adverse impact of COVID-19 on the world economy, and of course, actually clearly indicated that before then, COVID were projecting initially 6. We heard from just last week's budget for 2021 that rather economy, and especially the livelihood of the poor, government pushing the ordinary Ghanaian businesses and whatnot, and that the first, I wouldn't want to repeat the details because it was said earlier, but basically looking at electricity that we just heard yesterday that apparently is not even as free as all of us, the medical personnel, and of course the business loan, the popular business loan, I remember, is to have a social audit approach to go to the people who matter, those that this first, and if they really know about it, how would they rate it? They think that it was it that has to be done. So what we did was to zone the country into 3 ecological zones. We lockdown came, it was purely Greater Accra, and then we also look at Greater Kumasi. And then the last was that when we wanted to have seemingly some sort of a little rural, the lockdown, but at least Accra and Kumasi did. So that is why we did it that way. We that are actually affected by the intervention. And so one key group was the vulnerable, because if you remember during the lockdown, what we heard in the news, I'm sure your channel, in Savlugu we met some of said Kayais. And of course we also had to talk to some health workers who are supposedly the front line and those who are not part of the front line. It's called the general public. That will involve any ordinary person, though they may not have benefit. So these are the classifications. We had this in November. All this, but of course before then a lot of processes had to go through. before we got the participant, that the social auditors. I don't know whether we'll be interested in knowing the group.
All right.
For let's say for the general public, there were 77, and then we have the small businesses, 74.
Okay.
So these were the. But in terms of Savlugu, that's the North 103, and then we had Accra 60. Let me say that Accra, Kumasi, they were all over from all other places. Of course, Savlugu, not just only Savlugu, but.
What did you find? What were your findings?
Okay. So before I come to the findings, let me just talk about the basically educate or sensitize the social auditors on the whole AP. We had the COVID alleviation program. We know that MBSSI was the main institution in charge of the business. So we had MBSSI to talk about that component, also to talk about the food distribution and whatnot. And then we zoom in to what is called public hearing, where were in their corner. We had all the other groups in separate rooms talking about the findings. I'll tie that in with the specific things that may even not benefit. So awareness largely was high. I mean, we had almost about 91% of them. So that was just broad. But be that as it may, still we had some. It might interest you to know that certain persons with disabilities actually indicated. Information about the various interventions became predominant during the lockdown in Accra and in Kumasi. That was when we heard that the government was going to give free food and subsidy radio and TV. So the media was very, very, very important in this. 21% said they were aware. But particularly, they thought that the information, the way and manner that indicating that I am blind, how do you expect me to be able to watch TV? Because most of the information was on TV, indicating that if it's possibly in the Braille form, then that could be that could have helped. With stakeholder involvement. To what extent did the government involve key stakeholders? People thought that politicians were seen to have hijacked the whole exercise.
Oh.
And especially community leaders were there, but they were less involved. Let me quote, it's always better you quote from what he said. This a health worker. In my facility, administrators were rather made to be free of attending to the health needs of patients. I remember we heard so much about this frontline issues. So instead of using the community leaders who are frontliners of the community, politicians were rather used to distribute the food and other benefits. That PWs were left out in terms of the implementation process. Those who were given the need, as to how PWDs will assess the stimulus packages. Sometimes we had to struggle with those who are strong, and it was impossible at a point. So that is what some of the concerns that was raised so much. And so that is something that we think that has to be looked at. So aside that disclosure of the KP expenditure itself, we also had to basically looking at issues of openness. And it was missed in terms of the KAP expenditure issue. The results were missed. Amount they really did not know. They didn't know. Indeed, health worker indicated that the Honorable Minister's authenticity we could not be able to verify because it wasn't written anywhere for them to. Another person in Accra, but did not give the details on what and for how many people in terms of openness in selection and targeting beneficiaries. Indeed, majority about issue of diversion of food items and bias in the selection of frontline workers and businesses. The ground, when I bumped into them, I mean those who were distributing the food, they were distributing the food in an area that the person is vulnerable to get the food or not.
Right.
It's like if you are strong, thing too that people, especially in Kumasi, felt that It was actually sad. I went to one of the distribution center with a lady who had both her arms and part of the food. So to me, selection was kind of biased. That was a PWD person. It was okay. Some people felt that it was okay. Although largely people thought that no. And whom you know influenced food distribution. And this was mostly food distribution was distributed to party members or to people who support a party. When it came to the distribution of cooked food, they will now dictate where. Before even the food gets to the community, they will ask for names of members of their political parties' beneficiaries. A businesswoman in Ashaman said that so some persons got more than others. There's one impact to the food distribution. With regards to sharing the food items, there was huge to the vulnerable to his wife to sell in Kumasi market. The news was all over his, not knowing it was being diverted to the market. It was later that we had to find out from all others. And I remember one person, I moderated that it was almost on most of the platform indicating that there were a lot of suspicion. One interesting thing about the business loan, most people indicated that they did not seem to benefit and all that. Of course, it is a good way because we are promoting. There's an interesting thing that we found out that the vulnerable even had to pay to get their tin room. One person said, a businessman, people were collecting money for the tin. I paid 20 Ghana with respect to getting
the loans,
the MBSSI loan, because
I see.
that was bad to that extent. I mean, some people also commended that. Some have already received because they provided wrong information.
Right.
So that also tells us about the way. I know someone who applied for 30,000, but mistakenly they keyed in 3,000.
Oh.
So I applied for 30,000. Somebody keyed in 3,000. You make that I can use to expand my business. You are just telling the person that just take this and the like. Majority, around 61%, noted that the food distribution would hear that, oh, it is coming at this time. They will just go to the point. They will wait, and they wouldn't. By AMA, PWD indicated that yes, it was timely. The electricity on water was timely. In terms of inventions like the PPEs, the water, electricity, the loans, etc., they thought that we would have preferred uncooked food other than the cooked food. Because there were instances of some of them indicating that the cooked one they got was of very poor
standard.
quality. It's just something that I wouldn't really want to eat, but I'm forced to because the fact is that I don't have any means. 7 bags of fertilizer, which was less than what I needed. I think the person was not enough. The alleviation fund is not adequate because it was too small. I was giving, then we'll come to impact, and possibly that will be the last of it. Efficiency, how relevant, and I'll score them. That is the government 65%. But just the matter, of course, people said was useful, especially the 50% subsidy on water and this rating. Nevertheless, few participants, especially Kaya, indicated that the CAP they thought was not relevant. Usefulness of government spending money on water in this period because we are not benefiting. This was a Kaya that they are not also review same. Efficiency-wise, despite it actually needed much to be desired. All we saw on TV and shows a mosque to distribute the food. There wouldn't have been any chaos. Instances where they saw in their community certain churches were distributing and it was orderly. Certain mosques were doing that. The last had to do with impact. By impact, we are looking at immediate or short-term results because you cannot make. Indeed, majority opine that the COVID alleviation program was impactful on their household and businesses. We would have brought untold hardships to them had the government not intervened. And to that, through the free water, this was a health worker indicating that. And a KIA also for food and water. The water subsidy had a positive impact on me. I had reduced to 60. So that should tell you that yes, indeed, if somebody was always had to pay 120 cedis, what government did really help people. It is helping a lot. We used to buy a drum of water for to know that. In terms of the business, somebody indicated that my wife's cold store business was not flourishing during the lockdown. The time given us to start paying the loan, we'll be able to pay. So this who paid their bills. So although it was free, people also had this sentiment that yes, but government needed. Overall, in terms of rating, qualitatively, we realized that in terms of awareness, people rated it somehow. Their transparency too, they were not satisfied at all. In terms of timeliness, regularity, term, impact, people were satisfied. They gave certain reasons for it, but in the interest of time, maybe when we zoom into the discussion.
For now, Dr. Emmanuel Eifa has been giving us quite a bit of a cross-section of the report there. Thanks for the report.
Yeah, I think he's a friend. We've been working over the last 15 years together, and so I know for Sen in Africa.
Yeah.
So it's a great approach. This is not the first time Sen have used social audit. They have used it severally across Africa.
Yeah.
So it's a field they have created for themselves. So there's no question about that. The approach to the use by dividing Ghana into 3 zones was much more appropriate. It be quantified with quantitative figures. You need to allow people to socially want to deal with the emotions and feelings of people. When they are satisfied with their emotions, and try to gather the social, the socio-cultural, the perspective of how people are very, very important.
In your view, what would you say is the finding that stands out for you?
Especially the Minister of Information, since February last year till now, in Ghana, I have held them much more accountable. Because every 2 weeks I used to do surveys, and I would have released a survey. So I have done that every 2 weeks for 16 times. So I know the capacity of the Minister of Information. In fact, the coalition was the first to have published the survey on the use of the face in the country and how the state institutions should be able to have. If you had enforced the protocol very well, we would not have gotten to where we are. What I would say about the report, even though I still have some 7 previous studies, but this is much more, have been able to sectorally single out some special intervention out of within their capacity, which has exposed and is collaborating with other, but not in that direction. But of course, they are integrated, they are interconnected. So let me see. The government pretended they wanted to work with everybody, and I've cited in a lot of, but when it comes to the ground, the officials who were involved never wanted to work with civil society. And they never want to listen to civil society feedback that we're given. That's why I was praising the Minister of Information. Because for the Minister to some of the feedback that we were given, which actually helped. So, no matter how the resources civil society has and the social will that civil society has, interventions. And it's reflective in the Sen Ghana report. You see, state is the official state institution when it comes to providing social interventions. So, 100,000 of beneficiary of the LEAP. So, if they had every sub-metro, every district, they didn't need to attach any, support them, and they already know the other stakeholders on the ground. So, for example, this area we said, Kojo, they know every house here.
Yeah.
So that the approach was totally wrong. The third point is but we thought that government always work with state machinery. If they had used those state machineries, it would have created more. We really don't need to target everybody on electricity relief,
Right.
water relief. In fact, Kojo, somebody like, so if the state institutions were involved in discussing with electricity company of Ghana, and whether COVID or no COVID, salary workers were paid. Especially there are other private sectors who are doing well. Universities were paying their salaries. So some of them really did this emergency response cases. They didn't.
Right.
Like the other thing. Then more
Dr.
instructively.
Benaku, I'll ask you to hold on to your next.
What would you do if you have the choice to do anything in life? Bill knew there was a friend waiting to support you on all of your life's choices.
You have such a friend in Glyco Life Insurance. Glyco Life for retirement and takes the burden off your shoulders. So go ahead and live life to the fullest today with Glyco Life Insurance 218-500 or 246-142. Also visit our
Pushing you for life.
Upgrade your current DSTV package to the next one, and DSTV go bump you up to the one above that at no XTV step up for more, or call us on 0302 740 540. DSTV, it's your moment.
It's a new one with over thousands of Ghanaian products on exhibition, ranging from food, beverages, stationery, beddings, cosmetics. Made in Ghana Festival promotion is valid from the 1st of March to the 28th of March 2021.
Emmanuel Cleaning Service.
Traveling bag. Chanu needs. Now one blue kakra. Now medical trust selfie will airport.
Get your passport and luggage ready for the third edition of the Camel Antiseptic Buy and Fly to Dubai every week. You can also win instant prizes like airtime, hampers, and many more. Camel Buy and Fly 3. All COVID-19 safety protocols will be observed.
Sorry to interrupt your conversation, but I notice you are not wearing face masks.
Check my police bar view.
Oh, no, you know, try. COVID-19 is real. It's still like maybe infected with the virus. Yes, so you must do it to protect. I always carry spares around if you don't mind. Yeah.
In partnership with the Multimedia Group.
Na lamte busianye last week o. Nanso this week omo busianye. Moko upgrading one time. CCA ye the sports, entertainment, kids shows, and niyama bebre abrelam te busiamo entertainment for less. Cafe Dokra. You see Go TV app no for connect to Go TV Max so. And I pay by the point agent BIV. Love it.
Our money, wanna money, our money, wanna money, our money, wanna money, our money, I'm telling you, someone with you. Morris, babyface, what you say now?
Our money, Africa money.
I just got a text message. This will make you laugh. If I had the means to do so. That song can help conscientize our society, most especially politicians. Good morning, Kujo. Good morning to you, Karim. And thanks for listening. All right, so we are on correct, and of course, the effectiveness of the COVID dry food packs, which were distributed particularly during the lockdown period. And very recommendations of our two guests in just a moment. But before that, let me remind you that Ghana National Chamber of Commerce seminar on the 2021 national budget under the theme 2021 National Budget, deepen the understanding of government programs and projects contained in the budget and how business. The University of Ghana, Mr. Michael Boating, Mr. Evans Asare, all were both from KPMG, and Mr. Cobbs 2021 starts at 10 a.m. At the Ghana Shippers House in Ridge. So, however, is strictly by invitation, okay? Now, as always, M2021, you will be required to present a valid national ID card anytime you visit a Momo agent. That is why we're good together. Just Momo it everywhere you go. Now, which is 5 times better than standard definition. Get the new HD Plus decoder today from before. Go to hd-plus.com.gh or call 0242 Aku have been helping us with the assessment of the...
Here's some great, package for you. You can get news on your phone from Joy FM, and just about SMS text messages on the Super Morning Show is brought to you by Glyco Critical Illness Plan GSIP. It's in your best for you peace of mind, especially in this COVID-19 era. So, to our policyholders, your claims are very important to us, and we advise you to visit our office, your premiums via your chosen mode of payment, or by Momo on 0591441473, or by e-premium for micro insurance, or contact us via our digital channels. We care for your safety, so all offices are implementing the Ghana Health Services. We all do know that, it's Independence Month, and as we celebrate 64 years of Ghana's freedom, you need to gain your own freedom from the landlord wahala. So, buy that Apollonia City land or home. Start at 49 Ghana cedis per. So call us on 055-256-0444. 31st of March 2021. Terms and conditions apply. Apollonia City, Accra's best real estate.
And Dr. Eifa and Dr. Benaku are helping us assess the impact of the COVID alleviation of dry food packs, as well as the offering, outlining a few of his observations of things that could have been done better.
Poor use of languages. And I remembered I had to speak after a survey. But right from February up to May, they were just using English. Reveals that people were not getting the information well because very few people watch TV.
Yeah.
And so of our releases there. So there was that incapacity as a country. So that actually affected some of the impact. It's something I have talked about largely. I have spoken very strongly about it to the extent that it's disputed. Why? Government claims they always work with faith-based organizations. That's what I call hypocrisy. So it didn't. For example, I asked the government advisor, do you have sociologists on that committee or that task? A clinical psychologist, they didn't have. Until I spoke to the Minister of Information, I said, a family have COVID, and yet you don't have a clinical psychologist. But you have a state institution like the Mental Health Authority. What they need to package. Even as of today, people keep on using we're supposed to be using those words. Otherwise, we cannot fight it. So, it's because they're not the Ghanaian public. And that is still happening. The trust fund, everybody contributed, including me, when I was then the national chairman. We supported most of the districts, especially Brunhaven to the north, where people were not going. We were established. We contributed. We don't know how much we got, how it was used. There was no, inform. So when we were at the peak to now fight, I think that we have to learn from this. And I would like to share my
recommendations. We've got just a couple of minutes to wrap up.
Yeah, so in the interest of us looking at technical, what we think. Of course, the report has made it clear that so not only the COVID alleviation program, but any other intervention of such time for us to go and look at the Ghana National Household Registry. Targeting was an issue. From this far, extremely poor. But when it came to the Cape, it was difficult to target because we don't have very registry. So we are also recommending to government. The government should take that serious. We are aware that yes, it has started. That database can help us to target better.
Right.
So that is what I think we do. And that is the Obatampa, the Ghana Cares program, which is also related of 300 or so, 100 billion Ghana cedis. Political capture, if we are not up and doing with our targeting. If we don't involve, go down in the drain. So that is one thing that I think I will leave government with.
The response policy, that is very holistic. In fact, there are already state institutions that are responsible for security and civil society. We need to have a national policy. And for defense, interior, and health, they are listening. We would like them to table this to only COVID, but holistically, so that when it is happening, we don't select people. We recognize and award civil society and the media for the role. If civil society didn't do research, the media did. If the media did, they use civil society to a country that does not reward its heroes is not worth living in that country. So we want to call for
Dr. Gabriel Benaku. We appreciate you very much. Of course, Dr. Benaku is Deputy Country Director for Send Ghana. And God bless you both for helping us happen to those officers who abused the system. What do you think should happen to them? Tweet at us, use the hashtag JoySMS. Correct. 055 22 000 or send us a WhatsApp to the same number 055 Ghana Integrity Initiative GII, Ghana Anti-Corruption Coalition GACC, and Corruption Watch. All of it sponsored by Danida. Thank you for listening.
Joy and